Hey mamas! Today we're talking about scar mobilization. So who can benefit from this? Really anyone who has had any surgery or an injury. So moms after a cesarean birth, absolutely, this is perfect for you. Any abdominal surgery. So if you have one later in your life, keep this in the back of the mind and apply some scar mobilization once you're healed. We can also use this after a vaginal birth if you've had any degree of tearing, either perineal or labia, anything like that, as long as your incision is fully healed. So you can start as soon as that incision is fully healed. We generally recommend 6 to 8 weeks postpartum after cesarean birth because we want to be on the conservative side. So if you start before that, just be really gentle and mindful that we're not trying to tear the scar apart. We are just trying to give it a little bit of stretch and make sure it knows that it needs to move in all directions. When scar tissue lays down, it lays down like this. It's just all super gnarly, and it can actually create adhesions, which is scar tissue between two structures in the abdominal cavity that can limit mobility of our organs and of our muscles and all of the tissues in the abdominal wall and the abdominal cavity. So obviously that's not great. 93% of women report pain as their primary symptom of abdominal adhesions, and there is a significant correlation with abdominal adhesions and abdominal surgery. So you can't have adhesions without having surgery, and scar massage is still helpful, but it's very, very common after an abdominal surgery. Good news is scar mobilization is really helpful. It can actually help reduce sensitivity of the scar. It can reduce chronic pelvic and abdominal pain. It can get people off of pain medication faster after surgery, and it can reduce those adhesions, which improves mobility and function of that abdominal wall. So how often do you need to do it? Protocols vary enormously, right? We have some research studies that did 4 30-minute sessions over 4 to 6 weeks. And then we have some research studies that did 10 minutes at home on your own for 7 days, so there's a huge variety. Most of the time, I just tell people, get your hands on that scar every day for about a month, 1 or 2 months. It doesn't have to be forever, but you're going to see great results really fairly quickly early after you do this. So I usually suggest, 5 to 10 minutes at the most. We don't want to go so hard that we're creating inflammation. That's not very common, but I have seen that. And so we want to be gentle to start and feel how those tissues are responding and let them move under your hands. If your scar is very sensitive or very painful, you might benefit from meeting with a physical therapist in person to see maybe what else is contributing and how you can start in a way that is really nourishing and really positive and isn't just about going into the painful spot. If it's sort of sensitive and kind of uncomfortable, you might want to start with some lotion or oil or soap in the shower, or a soft washcloth or something just over the scar for a week or so, just to kind of desensitize that area. A lot of people say they don't really like touching it, and that's okay. So maybe put a barrier like a washcloth and just try to sort of get into your head that this touch is normal, right? It's normal sensation. It's not supposed to hurt, even if it does. That we have to remap that area. We have to kind of rewire our brains and bodies to perceive it as normal touch. So just kind of diligently going at it for a week or so may really be helpful. And again, if this is super painful, if you find yourself gritting your teeth, go see someone, get some help, because this may not apply to you, right? You may need a different strategy. So in the next little section, I'm going to actually show you and go through on my own belly, even though I did not have a C-section. I don't have a scar to work with right now today, but I'll show you basically what we do and what it should feel like and what you might notice along the way. All right, reach out if you have any questions, and good luck. All right, mamas. So like I said, I didn't have a cesarean birth, but I have worked with a lot of women who have and who have had all kinds of abdominal surgeries. So again, I realize this may be kind of mentally and physically challenging, and if it really is not feeling right, please go see a professional in your area. If you are up for it and you're feeling pretty good about it, and it's not hurting a ton, then let's get into it. So the bowel runs from the right hip up and over to the left hip. So I usually suggest starting with a gentle bowel massage, because this little circular motions all the way up to the rib cage, across under the rib cage, and then down towards the hip. This is actually stretching all of that surface tissue. So just by going around your abdomen, you're not even on the cesarean scar yet, but you're already making progress in the right direction. You're already teaching that scar that it needs to move in all these different directions. So when you're ready, we can go right to that abdominal incision. So I would just take your fingers and go for little light circles right over the top. And as I mentioned in the last section, if this is really sensitive or really too much to do with bare skin against skin, go ahead and grab a little oil or massage lotion or some soap in the shower, whatever feels right to you. Eventually, you might want to try it without any oil or lotion, because you can get more of a stretch on that scar. And what we're going for, again, is to teach that scar tissue that it needs to be mobile, right? So we're just trying to kind of stretch it in all these different directions very gently and progressively, and letting it kind of figure that out, that it needs to be able to move in all these directions, giving it a little extra boost. So we're going in all of these circles across the scar and back. We've got a larger bowel massage going all the way around the abdominal area, right hip up and over towards the left hip, because that's the way the colon moves. And at first we might feel like we're really just moving the skin. It might feel kind of sticky, right? So move that skin, let it be a little sticky. You will notice a softening in a few days, in a few applications of this. We can lift the tissue, right? So we can pinch and just roll that skin along, okay? So that might feel kind of weird too. But picking up that skin, rolling it along across that scar, vertical, horizontal, diagonal, all directions, whatever feels all right. And whatever feels sticky is actually a good thing to be trying to move in that direction. All right, so rolling, lifting up that tissue. Then once we feel like things are moving a little softer up at the surface, we can try pressing a little bit deeper. And you may notice that, it feels really sticky right under there, and you might not notice much difference. Now, there was a research study that looked at the difference between superficial massage and focus on skin rolling and lifting and skin stretching, and then the experimental group that actually went deeper and did this deep stretch and more like pinpoint on the painful points. And though there were only 28 people in the study, it didn't show much of a difference. So definitely more research is needed, but if you are feeling pretty good after just doing that first part, the surface, and getting things moving right up by the top, then that's great. If you are up for it and you want to go a little bit deeper and see if you can loosen those deeper structures, that's awesome too. All right, so I want to show you my cup. This is a technique where we use silicone cups, and we actually lift the tissue around the scar and create a little vacuum, so that we're basically doing scar massage but in the opposite direction. It's actually lifting up. So I brought a little bit of coconut oil, and that's just what I like to use. It's pretty neutral oil, and it stays nice and slippery for a while. So grab a little bit of coconut oil. I'm going to put it on my belly. And you can get these cups on Amazon. They don't all look this shape. Some of them are more like a little round suction cup, right? But we are just going to lift that tissue, and then I'm going to turn it and spin it and work it along the length of the scar. So we can also go up and down over the scar vertically. We can go horizontally, diagonally, circular motions, all those same things we did with the scar massage with pressure pushing downward, and then squeeze it again to release the pressure and then let go. So you have control, right? You can suction as much pressure as you want. I usually start really light and then go a little bit deeper. A lot of people really like this, especially after you've done the initial weeks of basic scar massage with your hands. This provides a little bit of a different stimulus, right? So we can kind of just, oops, I lost it. Go up and down over the length of the scar. And again, I guess the same protocols would apply, right? We would be going 5 to 10 minutes for at least a month or so, and you might notice even further softening and desensitizing. Yeah, all right. That's all I've got for you. Again, please see someone if this all feels like too much for you, and I hope it's helpful. Bye.